it starts to open up a bit of a world of going, well, what do you do with all this information? And yeah, I'm probably similar to you. Like, I don't necessarily think I have, well, I definitely don't think I have the answer, but are we also limiting ourselves in trying to find novel solutions for an individual when we assume that because they have this injury, we need to follow this particular process, yet we're actually limiting their potential to either have a better outcome in terms of healing or return to play better by thinking about, well, why do I actually think this has happened in the first place?
Yeah,
and not more importantly, I think too, like the big question you asked and we need to think about is how do I determine what kind of mechanical load I can apply? And yeah, this is where I think we need to think about, well, what kind of parameters do I consider to be appropriate to apply based on the presentation? Like a good example is thinking about tendon pain. It seems to be very acceptable, and for good reason, that a mild to moderate amount of pain with tendon pathology may be okay.
Well, this is the thing that I'm finding very interesting. And I've brought this up a number of times, and no one's, like, I've had a couple of discussions with the physiologist from VIS. He's a fantastic guy. Super intelligent, super helpful, and really interested. And, we've both spoken about this concept that neither of us are anywhere near experts in, say, bone physiology, but I've been begging this question to everybody and no one seems to have a really clear answer for me, which is, why is it that in the medical world, if any other sort of soft tissue or connective tissue structure is injured, we're extremely happy to put load through it. So if a muscle, you strain a muscle, within, as Jackie is showing, within a couple of days you can basically be loading it to quite a reasonable level. And that seems to be effective and useful, even in the presence, even in their papers they talk about a mild level of discomfort being experienced during. With tendons, exactly what you just mentioned, the evidence is pretty clear that you can continue to load it even in the presence of pain. People like Peter Malliaris have spoken quite a bit about that and how you kind of progress through that, and maybe more monitoring for symptoms the next day or further symptoms that develop, because obviously we know tendon turnover is a little bit slower and you're not going to necessarily get the response there and then. But with bone, as soon as someone injures a bone and there's a stress reaction or a stress fracture, obviously it's very different if there's a clear mechanical break, like someone, they get hit by a car and they break their leg.
Sure.
You're not going to ask them to walk around on it. Right? It doesn't have enough mechanical integrity to deal with that. But with something like a stress reaction, a stress fracture, why is it that we are overly conservative? Right? That we want zero pain at all times. Often, and we know that loading is actually useful for it, particularly in the long bones. We'll put someone in a boot and say, okay, as long as there's no pain, you can walk around on it. If there's still pain, then we obviously want you to completely unload it. But we don't want any pain with bone, and I don't really understand why. Obviously, there's a very big difference between someone experiencing a 1 or 2 out of 10 pain when they're walking around, say if they've got a stress fracture in their foot or in their shin, versus say like a tendon, the Achilles tendon might be the same thing, versus having zero pain, and what the difference would be there. I'm not really I don't have any answers, and everyone I ask doesn't seem to necessarily have any answers for me either. And I'm not suggesting that we should go down the path of just saying we'll just push through it. But I'm almost interested to see what would happen if someone was willing to try it.
Well, this is it. We're moving into the massive area of the unknown here. But even if, let's say, for instance, someone could do certain things pain-free, is that actually acceptable? Even if they've experienced no pain whatsoever?